Back in May, we were stunned to learn the Children's of Alabama had treated more than 40 kids who had been shot in only 6 months.
Over the last 20 years, we've seen firearm injuries and deaths almost triple in kids.
Fast forward to December, Children's has treated 75 children with gun injuries in 2021, a 60% increase compared to this time last year. We met back up with Children's ER Dr. Eric George to help us make sense of the numbers.
Big increase in firearm injuries, both unintentional and intentional. So we've still seeing a lot of accidental or unintentional shootings. And then a lot more violent crime as well.
George believes the concern over personal safety is one of several factors fueling this lethal trend.
And typically, if you're concerned that you're buying a firearm for safety purposes, many people will leave those firearms loaded and unlocked.
And that's what he's seeing in the ER.
So we're seeing a lot of increased unintentional firearm injuries just because of that, because people aren't storing their guns safely.
George took on research to learn more about local pediatric firearm injuries with hopes of stopping it. In Jefferson County, 1 in 3 children who were shot don't survive. 1 in 4 don't make it to the hospital. So far this year, 14 kids in Jefferson County killed by gunfire. That's up from 9 last year.
No one expects this. People say it's a freak accident, but when you're on the ER side and you see this happening multiple times a week and you're having the same discussion over and over again, you realize it's a pattern and that it's something that can be prevented.
George wants to clear up some common misconceptions. First, talking to your kids about guns isn't enough.
One study showed that 3 out of 4 parents said that their child would not touch a gun. And when the child was put in a research room, the large majority found the gun, looked at the gun, handled the gun, and then over 50% pulled the trigger. And that was immediately after discussing firearm techniques with your kid.
As for the demand for personal safety,
research shows that even if you own a gun for protection, someone in your family's particular children are more likely to get injured from that gun than you are to use it for actual protection.
He says gun locks are the best way to store a firearm. Biometric locks with fingerprinting is quickly accessible when needed.
I'm tired of treating firearm injuries. I want to do everything I can to prevent them. Right. And the whole point is to stop seeing these kids die from something that doesn't have to happen.
The Surgeon General recently issued a rare advisory acknowledging a growing mental health crisis among children. George says this is also fueling our local pediatric gun injuries. 4 of the 14 kids who have died from gun injuries this year in Jefferson County were reported as suicides. We have information to help you talk to your children about this crisis right now on our news app. Jennifer Horton, WBRC, Fox 6 News, on your side.